Hello everyone, welcome to the Levine Cancer Institute Department of Supportive Oncology YouTube channel. Today we have an informative panel discussion on head and neck cancer care. We have a diverse group of healthcare professionals here to share their expertise as it relates to supportive care in head and neck cancer. Thank you for joining us.
Here we go.
Let's begin with one of our palliative medicine nurse practitioners. Jessica, what are two common symptoms and challenges that patients with head and neck cancer experience? How does palliative medicine address these issues?
Patients with head and neck cancer can experience a variety of symptoms, and often it will depend on the location of the cancer and what cancer therapies are planned, such as surgery, radiation, chemotherapy. Pain is one of the most common symptoms that we see, and nausea is quite common in people getting chemotherapy. In palliative medicine, we are experts at managing symptoms and can help with both pain and nausea.
Thank you. Rachel, can you talk, speaking of nausea, Rachel is one of our registered dietitians. Can you address how patients with head and neck cancer might have challenges with their nutrition status and what kind of interventions you have for those?
Sure. Many head and neck cancer patients have nutrition impact symptoms. Some of those symptoms could be swallowing difficulty. They could be biting and chewing difficulty. We also see poor appetite. Treatment and then surgery can also impact these symptoms, leading to weight loss or malnutrition. That's why it's really important for patients to work with a registered dietitian to modify their diet, start nutrition supplements, or if they have a feeding tube, start tube feedings. We can certainly work on soft diet options at the grocery store, recipes for shakes and high calorie, high protein, or start your tube feeds that are specific to you.
Speaking of trouble and difficulty swallowing and chewing, Kaylee, one of our speech therapists. Kaylee, can you give us some background on what's the role of speech therapy in head and neck cancer patients?
Yeah, so a speech language pathologist helps head and neck cancer patients and their families manage the changes and side effects from speech, swallowing, and voice as well. Before treatment, during, after, really throughout their whole cancer journey. And so we may start even just with educating them about what they can expect in the short term and long term, maybe how a certain surgery is going to affect their swallowing. And then when it actually happens, helping them manage that with them really closely alongside our dietitians especially. And then again, kind of throughout, sort of helping them adapt to maybe a new norm as well.
That's great. Speaking of patient education and kind of getting people ready for treatment, Brittany, I know you're an occupational therapist. Can you talk to us some about lymphedema, a side effect we know is kind of common in our head and neck world?
Yes, so lymphedema is basically a chronic condition in which the lymphatic system is damaged, and usually because of the lymph nodes being removed and or radiation therapy. And basically the lymphatic system helps us drain and filter out fluids, as well as it's an infection control system. So when the lymphatic system is damaged, my best analogy is it's like a clogged sink. So we're not able to drain as well as we once were. So lymphedema is just an accumulation of fluid that is just swelling that usually occurs in the area of the head and neck. So that can impact swallowing, it can impact obviously aesthetics, as well as just, it can cause some pain, especially in the area of the head and neck. We can also work with those that also have something called trismus, which is essentially lockjaw from radiation typically. So that can impact your mouth opening in order to eat and chew and talk.
Wow, it sounds like these patients can use a lot of support. Lee, one of our social workers, tell us a little bit about the role of the social worker and how you help patients access the healthcare system and other supportive care services.
Well, each LCI location and clinic has an assigned social worker that most likely will be contacting patients based on referrals from the physician or the nurse. Those referrals can include anything from counseling, so a lot of times the first contact may be to assess somebody's depression or anxiety or just overall distress. But we also help out with more like transportation needs or case management needs, like financial concerns. So basically when we're calling, we're trying to figure out what the patient really needs the most, and then we try to focus on that and connect them with any community resources, or there's a lot of in-house resources at Levine that also could benefit the patients and their families as well.
Sounds like it's a really multidisciplinary approach, really takes a whole team. Karen, one of our nurse navigators, can you tell us a little bit about the role of the nurse navigator and how you help connect people with resources?
Sure. So I try to meet patients when they're first diagnosed in clinic. I like to meet them in person and start building a good rapport and a trust. And I assess them holistically. I want to make sure they have housing and transportation, food, caregivers, everything that they would need to be able to get to clinic and get the treatments that they need. And when I find those areas are lacking, I make referrals. And then, of course, follow up with patients. Let them know that I'm their advocate. I'm there to support them through their treatment. Because sometimes they feel more comfortable talking with me than they do other team members. And just make sure they have what they need.
Absolutely, and it sounds like you just talked about kind of the continuum of care, so
Yes.
people from the beginning of their journey all throughout their cancer treatment. Jessica, that brings me to a question about palliative medicine. How does your initial assessment differ from a follow-up appointment? What would that look like?
Yeah, so an initial appointment in palliative medicine would be with one of our physicians. Typically, it's an hour long, and it's going to focus in detail on any symptom you may be experiencing. So as we discussed before, that could be pain or nausea. Some other common symptoms we manage may be decreased appetite, taste changes, diarrhea, constipation, difficulty sleeping, among others. So this will be thoroughly assessed at your consult appointment with us, and a individualized treatment plan will be developed. For follow-up visits, you may either see the physician or an advanced practice provider called an APP, such as myself, a nurse practitioner, or a physician assistant. At follow-up visits, we'll adjust medicines as needed, change your treatment plan as needed, and follow along closely.
So it sounds like their symptoms may change as people go through their treatments, as they begin radiation or end chemotherapy or start an immunotherapy. They may have different side effects and symptoms. So those follow-up visits, I'm guessing, could change based on what somebody presents with on any given day.
Yes, definitely.
Absolutely. And Kaylee, that brings me to a question for you. In the speech therapy world, I know you guys have very specific interventions and tests that you do to kind of come up with that therapeutic plan. Can you tell us a little bit about what one of those visits would look like?
Yes, for sure. So we are lucky here at Levine Cancer Institute to utilize some different tests, particularly to assess swallowing is probably the most common. We can perform modified barium swallow tests, which is an x-ray of the swallow, as well as utilize a scope, which is done in office, and we have people eat and drink different consistencies. We watch it up on a video, record it, and we can really kind of assess someone's swallow safety, their efficiency, and help give them a specific diet at that time that is appropriate for them, and then sort of use that to build up from there. And this will really wax and wane. Someone may need multiple of these tests over the course of their cancer journey. For instance, after they have surgery and they're cleared by their surgical team that there's been enough healing that we can start looking at their swallow function, we'll do a modified barium swallow study so we can really see it, because I don't have x-ray vision, so I can make the best judgment that, maybe now their tongue looks different, or, something in their throat is different depending on the surgery. And I can get them started on something, which Rachel then helps them also kind of progress from there. But, if they then undergo another, some radiation or some other treatment, then that's going to look different, and I'm going to be constantly reassessing and constantly addressing the need at that time. But we have some great tools and resources here in order to do that, objectively and not just subjectively.
So Rachel, it sounds like kind of based on some of what Kaylee and her team discover in speech therapy, it may change the plan of care you've got for a patient. What are some of the most common questions you get from patients kind of about these changes that they're going through?
Yeah, so it may be that maybe they weren't on a diet before, they were just on tube feedings, and that was what was providing all of their nutrition needs. And now Kaylee has passed them to start eating. So they may wonder, what kind of foods can they eat on a pureed diet? What would be a good way for me to add moisture to my soft foods? And so we'll provide them with soft food list and give them tips on ways to moisten their food with like gravies, sauces, and broth. We do a good education after they meet with Kaylee. Or it could be that maybe Kaylee meets with them and sees that they aren't safe to swallow and maybe they were eating before. And so at that point we would make a recommendation for a feeding tube and start tube feeds so they can meet all of their nutrition needs, including their calories, protein, and their hydration.
Well, I can imagine that as patients go through that journey and face these new and different challenges kind of at each turn, that probably brings up a lot of emotional feelings and lots of thoughts. And Lee, how does the social work team kind of monitor patients' progress and kind of help them along each step of that journey?
Well, a lot like navigation, when they come in as new patients, we assess their overall distress, depression, anxiety. So we have a whole team of social workers that are clinically licensed. They're able to provide counseling services to the patients. A lot of times those referrals will come from the physician or even from their family saying that the patient's struggling with accepting this new lifestyle or changes that they've had. So we'll reach out, contact them, kind of be able to provide either a virtual support or over the phone, or we even try to see them in clinic. So we try to meet them where they are and provide that added level of support to kind of get them through this journey.
And I suspect that those changes as they come impact their navigation needs as well, Karen. So as people go through their journey, do you help them troubleshoot some of the more complex issues as they arise? You jump in and maybe assess for financial needs or transportation and then kind of distribute those to the team as needed? How does that work?
Well, it does all start at that initial assessment when I try to discover what their needs are, but then it may change during treatment. I often will just check back in because sometimes they no longer have transportation and they need that referral to transportation. Caregivers change. Sometimes their diseases has changed and they just need more support, so often I'll make a referral to social worker to get back in. It does change and I just try to be there to meet their needs.
As you were talking, Brittany, and I was thinking about lymphedema and how the swelling might impact sort of your that outer appearance. I always think that one of the things we talk about with cancer is it's a private journey, but sometimes there are outward signs that the rest of the world can pick up on. When you're looking for changes like that, is there like a change where you would say, this person might be having some body image issues. Should I refer them to social work? Are there touch points along the way where you can say, at this point, I need them to do this, like give patients a heads up to say, I've seen this difference in you and it looks like we're headed down this way, you could use more of an intervention. When do you kind of tap in on some of that multidisciplinary support in that way?
Throughout the whole continuum of care. I do find as a therapist, luckily, I get to spend an hour with patients. And so a lot of those issues may be surfaced in my session. So I certainly, we have access, we are a great team here at LCI, and so we're able to kind of make those referrals to the team.
I think it sounds like it's a very team approach for everything. It sounds like it takes a very well-connected and a strong relationship between all the team members to really make all of this happen. How is it that you collaborate with each other? Do you see the same patients in clinic on the same day? Do you refer people out? What could a patient expect if, say, Kaylee, you saw them in speech therapy today, but you identified X, Y, and Z? If you were going to refer out to Karen or to Lee or to Rachel, what would the patient expect to see after that appointment?
Yeah, it can really vary. It's a mix of both, and it can depend on where the patient is coming from as well. But I would say typically we're really lucky in the head and neck cancer clinic itself to be embedded there with the head and neck surgeons with nurse navigation and dietitians especially. And so even in one appointment, someone could see the surgeon for an evaluation or check-in. They could then see me in the same room, and I could address their needs as it relates to what I do. And then Karen could go in and talk to them as well, and then same with Rachel. And I think what we really are good at doing is kind of conversing together, not just saying, okay, your turn, but hey, in talking to them, this sort of came up. Rachel, they were asking questions about their feeding tube that, is not really my expertise. Can you address those with that patient? Or Karen, they don't have a caregiver with them today. Have you touched base with their, support system lately or something of that nature? And then I think a lot of times, because I work so closely with other rehab teammates, it's usually me saying, hey, this person needs an occupational therapy referral for lymphedema. And I'll go to the nursing staff and the provider, and they'll put that in. And so then I can kind of often give Brittany a heads up, hey, I'm going to be sending this patient to you. And palliative medicine sees such a large variety of our patients as well. And so we often talk with them too. I think we have great communication. Some of it is right in person in the same clinic. Some of it is over our charting system. But I always tell patients there's a lot more going on behind the scenes with your care than maybe you can always see. And we really are trying to address like the whole thing. Social work has been so great about, if I reach out to them with a certain need, they usually call the patient within that same day or 24 hours, I would say. So it's really like a dream team. It's kind of a dream to work here too and have that support.
I know that the speech therapist, the navigator, the social worker, the dietitian are all in that head and neck clinic with the head and neck cancer patients and the doctors and all that. If a patient was requesting a referral to see palliative medicine, maybe for some additional help with pain management, maybe requesting to see occupational therapy for something like lymphedema, what is the best time in their treatment for them to ask for that, and how do they advocate for that for themselves? Just could you maybe talk a minute about how patients can advocate for themselves for some of that extra level of supportive care?
Yeah, certainly. So we would prefer to see you early on at diagnosis so we can be proactive in your symptom management and prevent any uncontrolled symptoms. So you can get a referral to us at any time during your cancer journey, but I'd recommend at the beginning so we can have a plan for symptoms that may occur or for symptoms that are already occurring. We are happy to be flexible. Oftentimes we'll communicate together and say, hey, the patient's coming in next week, can you see them the same day? And often we're able to make that happen and want to make that happen to reduce trips here and to help coordinate care. So we all work together really well, and I'd say get in the earlier the better.
And Brittany, if a patient had a concern about lymphedema, would that be a referral that would come from their physician in the head and neck clinic, or would it come from a palliative medicine doctor? Where would that referral come from?
That referral can come anywhere, really. It can be primary care, it can be, any physician. We do require a referral within LCI because we are hospital-based. So a referral is required, but any physician could insert that referral into the system. But I'm going to kind of tag on to Jessica's question and just talk about when patients should come to lymphedema therapy. 90% of head and neck survivors have developed lymphedema. So I encourage everyone, again, to get a referral. But obviously, and you can come in even pre-op, so we can talk about some educational tools and just provide as much resources as we can. So.
And Karen, I'm going to put you on the spot here and say, I know sometimes patients have trouble advocating for themselves, and I know part of what you opened up earlier and said that sometimes patients are more likely to come to you just because it's a very easy relationship. When you talk to patients about advocating for themselves, can you encourage them to seek out these services, or at least let you know that there's a problem? Is that the best way to get things like that started?
It is. And when I first meet a patient, I usually give a large packet of information that has some educational materials, some additional resources, and then most of the education I give is about resources here, a lot of supportive oncology things like palliative medicine, smoking cessation, financial resources in case they need that, financial navigators. And so I like to give them a lot of information, even if it's a little too much at first, so they can go back to that packet. And I'm always reminding patients, if you ever feel like you need this, please let me know. I can help you get an appointment. And sometimes when I mention them, they'll go ahead and say like, yeah, I would like to see palliative medicine. I would like to talk to a social worker. So I try to go ahead and initiate those early on. But patients often call back and say, well, I thought about it. I really would like to do that. Now, I had a patient call this morning that's well into treatment. He said, my wife's decided, I really do need to talk with someone. So it's throughout the journey that they'll reach back out and ask for those services at times.
And I think it's really great that we have services available to help people make that journey to ask for some help.
Yes.
Because I think sometimes people have come to think that they have to live with a certain amount of pain or discomfort or nausea or any of that. And we have so many services in place to help with all of that. To make the access to those things easier is wonderful. You're a wonderful conduit for that kind of information. Thank you everyone for tuning in to the LCI Department of Supportive Oncology YouTube channel. Please like and subscribe this video and feel free to leave comments or add additional questions you may want addressed in the future. Thank you.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.